Women's health is a very vulnerable type of healthcare too. Just think of the organs that we deal with. And many times people share with us things they've never shared with other folks in their lives. So just
All right, we're here for another episode of EIC, Entrepreneur Impromptu Conversations. I have the esteemed privilege to be here with another esteemed guest. She's going to introduce herself. We're going to get into our conversation. Go ahead.
Hi, Marcus. I'm Sosa. I'm an OBGYN who is the medical director for the OBGYN centers at Golisano Children's Hospital of Buffalo, and we're here recording in our clinic today.
This is amazing. I been wanting to interview you for quite some time. I've had a couple of interactions with you and you dealing with your clients in such a way that you don't see most doctors doing. Where do you get your passion from the work that you do?
Good question. I don't know. It's just there. I really enjoy taking care of women, and so many times the stories that they share are just applicable to so many of us, and many times folks feel that they're alone. Women's health is a very vulnerable type of healthcare too. Just think of the organs that we deal with, and many times people share with us things they've never shared with other folks in their lives. So just realizing that where I am afforded this insight into a very private part of people's lives, where they may share very vulnerable aspects of themselves, I just take that really seriously and really want to show women that they do have a space in healthcare where they could feel safe and know that they're getting good care.
Got it. In your opinion, why is women's health something that people shouldn't be ashamed of?
Because it's like anything else, you have an elbow, you have an eye, you have a brain, and the health of those organs, the heart, the kidney matters as much as your uterus, your ovaries, your vulva, your hormonal health. So just like anything else, it matters. There's no shame in it, despite societally, historically what we've associated with it. And, thankfully we live in a 21st century where at least we could speak a little bit more openly about periods, about fibroids, about pelvic pain, whereas in the past so much of that was stuff that we hide. We just had an event over the weekend. We talked about the fact that girls from the very beginning, from their first period, are taught to hide, and nobody knows that you're supposed to have one. And so that societal effect of how we treat those organs, I talk to women in menopause who say, don't talk about the fact that I'm having hot flashes or it's embarrassing. So I think the impact of how society treats things related to women's health then unfortunately has impacted the specialty, and we still have to realize in order to truly have a positive impact on these women's lives, it can't be a secret. We have to be comfortable having those conversations.
Do you think that there's a difference between now and after COVID, and people being more embracing in their mental health when it comes to women's health now? Yeah,
absolutely. That's a really good point. I think the realities of COVID and how much it really opened up the fact that mental health affects so much else of our lives, and vice versa, that folks have been more comfortable with sharing their struggles, even just discussing diagnoses. I think I recently saw this African-American author, Kennedy Ryan, with a picture of her antidepressant medication, showing that proudly, and realizing that, we all may have some, not all, but many of us may have either a diagnosis or some other mental health concerns that we don't have to hide. And many of us are being treated, and when you're treated, your quality of life improves, your memory, your sleep, your relationships improve. And thankfully, that's one of the good things that came out of COVID, that openness and comfort with sharing that. Yeah.
From that event that just happened on Friday, what were some of the conversations that were had that may have had the most impact on you as a physician?
It was a really awesome program, and I'm not saying that because I'm one of the organizers, but it truly was. We created a space specifically for women, and specifically prioritizing Black women. And our author and speaker who is a physician and author of the book A Terrible Strength, she was really clear that historically and systemically in medicine, we have not done right by women. We have not done right by Black women in particular. Okay. She highlighted the fact that the field of gynecology was perfected and learned on the bodies of Black women who were enslaved. They learned and practiced how to do certain surgeries, how to do C-sections on Black women who were slaves with no pain medication, obviously with no autonomy for them to agree or consent to that being done. And yet, despite a field whose foundation is based on the bodies of Black women suffer the most. We know about the poor maternal health outcomes when it comes to maternal mortality and death when giving birth. We know about that women with fibroids are more likely to suffer for a long time before they get treatment. And if they are treated, the only option that they're offered is a hysterectomy, although there are other uterine preserving options. We know with menopause, Black women suffer symptoms of menopause earlier and for longer and are less likely to be offered treatment. Okay. So it was really informative in the sense that she didn't hide the fact that we as a specialty and as a field have a lot to play in how negatively we have impacted the health of women and Black women in particular. But in addition to that, I think that stating that truth is important, so that women in our community know that we know. And now they could hold us to account for that. When a woman comes into the office, she also talked about plainly stating to your doctor, I know you see, however many people a day, you treat this one condition multiple times a day, but what about my individual risk? What about my risk as a Black woman? And if you don't feel that your doctor is aware of that and truly willing to address that, then find someone who does. She also, what was really great is how she helped equip them with how to come to that visit. She encouraged having somebody with you as a support person who may either help remember things you didn't remember about your symptoms. They may be able to help remember things that you and the doctor spoke about, so if you forget afterwards, you have that. She encouraged us to log and keep a diary of your symptoms so that you have objective data to bring to your clinician at that time. And so I think for me, overall, if I think big picture, the impact of having a space where there were women who are our potential patients, there were physicians in the audience too, who were who were Black, who were not Black, who were able to see, who may not even know the history of gynecology. They were able to appreciate that. And then women shared their experiences and asked questions. And we had civic leaders there also. And I think for us to truly impact health, it doesn't come purely from patients advocating for themselves. It doesn't come purely from doctors saying, this is what I do when I see you for 15 minutes in the office. We also need policy that impacts this. We also need government dollars to be invested in research and invested in the quality of care we have for women. And I think this was, I can't say, but this was probably one of the few times, or one of the first times we had it for Black women specifically, where all these different pillars that impact health were all in the same place. And we started to have this conversation. It wasn't a panacea. We didn't solve all problems, but I think is the first of many that we need to have to truly make a positive impact on women's health in our community.
That is awesome. I know that's going to have an effect. And were there anybody there that documented this and made sure that?
Yeah, we did have some folks from our team, our Collider team, who took pictures. We partnered with the Erie County Commission on the Status of Women, and they were the official videographers. Okay. So hopefully we'll get all that collated this week and start to put out information and a recap of what took place. Yeah.
Now, I've been watching you for a while, since our first encounter, it seems like you have switched gears as far as being more public, more on social media when it comes to LinkedIn and showing your professional goals. What are your goals for the next 5 years, if you don't mind me asking?
I think my goals are really to have a bigger impact on women's health. The change happened with the change of my job, being the medical director and not again wanting to just impact folks in the clinic.
So you changed positions.
Yeah, I think,
okay.
yeah. Mm-hmm.
Cool.
So my job before I was just a doctor. my job before I was just a doctor, seeing patients in the office and doing surgery and impact how our hospital, Golisano Children's Hospital, Buffalo, sort of our strategy around women's health and how we address health of our community, because our goal truly is to improve the health of our community. And you could do so much by seeing an individual in the clinic, but when that individual leaves the clinic, they still may have transportation challenges, childcare challenges, trust issues with the medical system itself. And I also have a degree in public health, and I understand the impact of public health on individual health too. So with this job, just being able to have a bigger platform where I have that impact, and it's not again my individual patients, but now what does it look like for women in all of Buffalo? And how do we partner outside of the hospital and the healthcare system with Erie County, with our elected officials, with education, with things like that? How do we partner with them to truly impact the health of our community?
Got it.
So healthcare outside the clinic walls.
So your reach is even further now. It's not just the patient.
The individual one-to-one interaction, which is vital and important and something I still love. I still see patients, I still do surgery, but then I sort of get to think about it on a bigger picture too. Yeah.
Got it. That is awesome. How do you think this change will impact the whole schema of things?
I hope positively. I truly hope so. It's really important, again, just harkening back to the fact that what we call the social determinants of health impact. A person may come to me because she has heavy periods. But what impacts the fact that she may have taken 2 years to see me is that she may have had a negative encounter with the medical field in the past. In her community, it may be a secret to not talk about your period, so she's never talked to another family member and realized these heavy periods are a problem. She's totally normalized that. And so by going into the community and educating community members about these things, conversations I can't always have in that 50-minute visit, it helps to inform our community, it helps to empower them, I hope. And then as we think about how, when our government, when our elected officials decide to allocate funds for health, right? There's free breast cancer screening. Is free because somebody decided to advocate for that. Period products are really expensive. Is anybody doing that? We don't know. But when we do work like this, and when we sort of start seeing again how it impacts just groups of women, not an individual, we could see, oh, this is a need for our community. Then can we let our elected officials know that we can meet this need? Can we as a hospital system say, and we did it for us, we now have at one of our sites a period pantry where it's free period products for everyone.
That is
How
awesome.
do we partner with nonprofit organizations in our community to do that? We partner with another organization. So that one organization was the Buffalo Period Pantry. You could come, anybody in the community, you don't have to be a patient, could come in, get free period products at any time during our office hours. And then we also partner with Every Bottom Covered for pregnant patients, where we know diapers are really expensive in their last trimester.
Every Bottom Covered.
Exactly. It's cute, right? Yeah. But in the last trimester, all our patients who have kids 3 years and under have access to free diapers and even other products on a monthly basis, so they could come and collect that each month. So again, a mom may not come to visit because she doesn't have transportation. We recently got a grant from a local nonprofit to help provide those needs.
Oh, wow.
So they meet with our social worker in the clinic, and then our social worker decides what needs they have and how we could financially help a patient for things like that. So these are the positive ways in which I see us impacting things outside of just that one medical problem that you have.
Now, thinking back to when you were a little girl, do you think that when you experienced your first period, was it handled the right way? Was it hidden? What was that?
A little bit of both. I remember my mom sitting down with me and having that conversation about what a period was and what it meant. Like, we had a whole book that we read through.
Okay.
So when it occurred, I knew what it was. I knew what to expect. But I'm Caribbean, and so in our culture, people are very secretive about their health care. Like, I know people don't even say the word cancer because they think by saying the word
they're gonna get it. Okay.
So from a cultural basis, yeah, it was secret. You're sort of known that not even your husband is supposed to know you're on your period, which I think is a bizarre thing.
How does that,
as an adult, I now see it's bizarre. Exactly, but that's how we grew up as kids, as teenage girls, thinking, well, definitely no boys in your class should know, nobody else should know, this and that and whatnot. So yeah, I did have kind of a little bit of both, but I was thankful that my mom really, sat me down and had that conversation about this becoming a part of my life eventually.
Got it. Yeah. From your perspective, what should moms do to prepare their teenage or sometimes earlier?
Yeah, preteen, yeah.
To have that conversation and to educate them and help them not to hide that situation?
Well, I think one thing we as all parents now should realize that our kids are getting a lot of information from social media. And as much as we want to keep them innocent, or even we think they don't know, they actually have several other, more than we had as a generation. They have so much access to information, and that information that's wrong. So do you want your child getting not her information, not just from a classmate, but now from some random person on the internet who's going to make up stories just for their engagement? It may be true, it may not be true. So it's never too early, to be honest. A girl could get a period as early as 9. So before that, probably around 8, you should start having a conversation about the human body, just as how we talk about, don't be on screens for a long time because it could damage your eyes. Talk about the reproductive organs in that manner. Normalize it. Use the real words like vagina and vulva and penis. If you say other words, that's also not good. That also helps to shroud it. Yeah. So be real, be open, and when they have the correct information from a trusted adult, they're more likely to listen to that, or at least encourage a conversation. So when they hear stuff on social media, when they hear stuff from their friends, they'll come and ask, is this true, Mom? I heard, my friend said XYZ, and you could correct them. But I don't think any of us want our kids to get their first information about this from social media, from TikTok.
So they want to get it from their parents, or the person that's involved with their guardianship.
And again, treat it like every other organ. It is not something to be like, oh, that's so weird, or normalize that it's okay to say uterus, it's okay to say breasts, it's okay to say that this is what the organ is, and this is what it does. These are the things that could cause pain or discomfort. This is how we manage it. Yes, it could cause pregnancy. We're not gonna be getting pregnant as a teenager. Have that conversation.
What was in some of the things that you said, that period care and prevention, they're not, I would have thought they were gathered together. You said that it's more expensive for...
period products are expensive.
I would thought they would be together for as far as pregnancy prevention, as well as, with a... together.
Pregnancy prevention is purely, if you you see us for birth control, but when you think about, I'm talking about like pads and tampons, right?
No, I'm saying, I thought that all would be in the same...
Right, and I think, you make a great point, and this is the stuff you think about when you sort of start thinking on the bigger picture, right? Perhaps there is somebody out there who would be lobbying that, maybe healthcare could cover some of this cost for us too. But it's not. So women have to, we call it, I think we call it the female tax or something, because women have to spend a lot more money
Wow, that blows my mind.
Yeah,
that blows my mind.
If you imagine if you have a long period or a heavy period, you have to spend that much more on these products.
Wow.
And you have to decide between that and feeding your children or transportation costs.
And you were mentioning that a lot of the studies have been done on African Americans. That kind of makes me think about why women, African American women, I'm thinking about my mom, she would spend weeks on the couch. As a kid, I didn't know what was wrong with her. But after thinking it back, and I'm older, and I'm married, she was going through pain. And she tolerated it so much every month that she would experience that pain. It would just